seen in data published by the ONS, non-COVID excess deaths continue to run higher than they should. People are dying unexpectedly across all age groups, particularly, it seems, at home. Since restrictions in March 2020, there have been 111,000 excess deaths in people's own homes, and in the week ending 22nd of December 2023, deaths at home were 11% higher than the 5-year average. In the first 11 months of 2023, over 21,000 excess deaths took place at home, roughly one every 25 minutes. Just last month, an article in The Lancet, co-authored by the head of mortality analysis at the ONS, stated that while the causes of these excess deaths are likely to be multiple, ONS data did show some clear trends. In particular, the largest relative excess of deaths since the pandemic occurred in young and middle-aged adults, with cardiac deaths happening outside of hospitals the most elevated. In other words, young and previously healthy people are dying at home from cardiac-related events, and we don't know why. They go on to conclude that timely and granular analyses are needed to inform prevention and disease management efforts. But let's be clear, this is not a new phenomenon. Experts have been raising concerns on excess death as early as 2021. I remember seeing an interview with Professor Carl Hennigan, the Professor of Evidence-Based Medicine at Oxford University, where he called for an investigation into the 75,000 excess deaths at home between the period of March 2020 and October 2021. 90% of these excess deaths were not COVID-related, but were things like diabetes, heart disease, and also cancer. Many of these deaths could have been prevented had people not been dissuaded from seeking care, because all they were told everywhere by the media, by the government, was stay at home, protect the NHS. Or maybe they had tried to get help, but were dismissed by a health service only concerned with one disease. Those calls for an investigation went ignored then, just as they are ignored now. Perhaps the COVID inquiry, as others have said, should make better use of Professor Hennigan's time by asking him about this topic rather than the tittle-tattle they seem to revel in. The pertinent question is, why did we lock down at all? And this is really what I think is the biggest damage. Time's of the essence, Sir Gary, so I want to finish just by saying, look, we can all speculate on the cause of this excess deaths, which are clearly happening, from withdrawal of healthcare during lockdown, the increased risk of sedentary lifestyle and alcohol consumption, the impact of the pandemic and related restrictions on NHS staffing levels, increase in NHS waiting times, lack of access to emergency care, the COVID-19 vaccine adverse reactions, or some other unknown cause. A mix of all of the above, perhaps. But until the government commits to a robust and independent investigation, we just won't know for sure, and the speculation will keep going, and that's why the government need this investigation rapidly.
Thank you.